In terms of clinical services, issues to do with treatment and so forth, is very remarkable service. But we have observed that few areas that it needs also management improvement. We have looked at the issue of drugs. We do have drugs, but in the labs, the storage is an issue, and also maintenance of records. You know, you cannot have the bin card in a separate place and you have stocks in another place. Then again, tracking becomes an issue. So if the problem is the issue of space, then I think it's need to establish a drug storage just to facilitate that process. We also observed that there are lapses in periods of drugs. In terms of what we saw in the last consignment from particularly the Faro Hospital was bought in October or is it August? But we have also seen some supplies now from the county to support a facility somewhere in October. We have asked for a report. First, to make sure we are able to support you in terms of improving the treatments of cancer. Because we have made observation when we go to countries that cancer has not been able to achieve a reasonable fill rate for essential drugs. And I think this is also what is pulling us back, and we would want to have a conversation with them. So looking at what was ordered by the facility in October, a consignment of about 13.5, was it 20?
23. We submitted a request for 23 million. We were supplied with 13 million.
13 million. You see, that's almost 50%. We have asked for what was to be delivered. We have asked for what was supplied, because we also want to have a conversation with cancer. But we have also known that we have only paid 2.5. So we also need to pay your debts, you know, so that we don't have excuses of cancer saying we have not been paid. You know, that is, if we give these agencies opportunity to get an excuse, then we are not making progress. And we have no reason not to pay if we have the money. And at least I know releases, you know, Governor, you are doing better than last time in terms of releases to counties. So when we have an issue around there that needs to be looked at. And we have looked at your maternity. Staffing is fairly good. But again, this issue of privacy and patterns, I think is something that needs to be addressed. Surprisingly, in your facility, the bed capacity outstrips the demand. So it looks like people in Nyamira are either doing family planning or they have decided to stop that business. So we are still looking at what could be the reasons as to why. Because in Longisa, for example, the bed capacity for maternity is 64, but the demand is 120. This is completely opposite in your place. Starting with that subcounty hospital where there is no mother in the maternity.
Though in Longisa we also noted very young girls. There are 15 who are delivering and classified as mothers.
But we also had school children here. But you know, our mother is not here. So I think this is an issue there. Then, Governor, we have two major projects that we have a serious problem, and I think we need to address. One is the COVID center. I think there is need, as a matter of urgency, to make sure that whatever the discussion we are going on is completed, because that magnitude of a project to be abandoned is a challenge to county. So I think part of the things we wanted to understand, and I think because we didn't get the public works, when we do our report, I think the clerk will be communicating on a number of things we'd like to require. One, the contract period, the contract sum, what has been paid, where was the dispute, what is the status of the public works assessment, so that we are 2 on the Doctor's Plaza, but it's already complete. There is need to make sure it is operational. You know? Because it was a Doctor's Plaza, it means you want to get these consultants who are here in Nyamira to operate from there. One, they will support the facility there by being available near the facility so that patients who come to public facility can also benefit from those services. 2, by them operating there, they will support your lab, they will support your pharmacy, because they are not going to come with their pharmacy. So there is need to operationalize, because what we have found there is a blood, is it a blood transfusion lab? And we cannot quantify the lab. There's only one microscope and one thing. So they need to, you know. Of course, your team has discussed the issue of equipping and the associated costs. But we are also recommending to counties that we also now, as counties, need to grow up and begin thinking of how we are going to place equipment as opposed to procure. So we cannot have that complete beautiful looking building and we delay the cost of implementation. Of course, we have noticed there's some little work that needs to be done in terms of finalizing. Ask the contractor to move the equipment to that looks like a construction site where the building is complete. And if the contractor has handed over, then it needs to move on, finalize on the issues of landscaping. And please let's make sure also the walkways around those things. You know, otherwise you make it impossible. The cleaners will be doing a lot of work. We've been to the mortuary and I think there's an issue around the mortuary. The progress, well, we've been told the contract period is 6 months. The contract has already expended 4 months. We hope he's going to be able to complete on time. But I think there was a challenge in the decision of closing the mortuary. Of course, members of public who cannot afford to go to private will have a little bit of a difference. We have expected that at least there would have been some site provision of that service. And the officers have explained that the mortuary was not working anyway. They were doing the preservation. And you see some of these methods, although we want to discuss them, they have been working. And for the time being, before we reach the sophistication that we desire, I think we should allow them to work. We were in Kisumu County, was that Aero sub-county or something?
Yes,
Aero, or wherever it is. You know the temperatures in Kisumu are a bit extremely high and low. But just using the normal preservation of formalin and that pumping work, they would do preserve a body for even 21 days without a fridge. So the decision to know to refer bodies to go to private hospitals and private mortuaries without an arrangement and understanding of the government, then I think the people who might have a challenge in terms of financial capability will sit there to study that. So there is also need to make sure that that contractor completes that on time. You know, he now has only about 2 months. There is need to make sure that the project management team are on top of their toes in supervising the contractor to make sure they deliver on time. Otherwise, that is an improvement. Looking at the capacity and what is going to be able to handle, I think it's going to support the project now. More public people can access the government facility in terms of the mortuary, and of course there's the improvement in terms of the body and so forth. But we have also observed that you may need to also prepare some temporary places for families who come. You know, we are a very religious nation. Sometimes people want to display, so even as the larger plans are ongoing, there is need. But there is need to make sure that that contractor delivers on time and that of course, you know, the decision to start that service, modernize. I think there was a bit of some gaps there that needed to have been looked into. Finally, I think on the issue of staffing, and I will allow my colleagues to add if there's anything else I've forgotten. On the issue of staffing, we have know that there are doctors on training. and also the other cadres. I think it is extremely important that we ensure that even as doctors go for training, particularly those who are going to specialization, the other cadres must also go, so that when consultants come back, they also have the other specialization to go at the same time. And I think that is a discussion under the human resource health we need to have. Because it will be futile to have a consultant in renal and we don't have renal nurses, or people specializing, we don't have ICU nurses, who is going to support this doctor to be able to do it. So I think that systematic growth in all the cathedras are important. And of course, we are asking that you make sure that those contracts and officers are also wounded, to make sure they come back. Bwana KMBDU hatutaki watu wakisoma, kila mtu anataka kwenda Kenyatta, kila mtu anataka kwenda KMTRA, kila mtu anataka kwenda NTRA. You know, and already you have gone there. Mnaenda kufanyia wakazi, tunawalipa mishahara kama counties. So we are going for double losses. But anyway, we have accepted the loss of for the time being. And then we are addressing the national government. But we want you to come back. Because the purpose of Nyamira sending you to specialize is so that you come and improve services in Nyamira. But if we send and then you want to disappear to Kenya, you go and disappear to another place, then it will take time for us to be able to improve services. And we want to really thank those doctors, the consultants who are cooperating the rural counties of this nation. Because that is also where populations are. And those populations also require services, just like the populations in urban areas. I think I have essentially covered a number of things, but let me allow Senator Nyamira and any of my colleagues, before we allow the governor to respond. We don't intend to keep it long, but we shall do a report. Again, we shall make sure it comes to you. So that's it. And I think one more item I forgot is on the issue of grants for the county. Governor, it is a miracle that 101 facilities are in the county on and that is a budget of 40 million.
It's a mistake. We are tripling it.
There's a problem here. And looking at your budget, looking at your previous budgets, there seems to be a systematic decline in budgetary allocation to health and particularly for government. I think, Governor, you have to do something. We would have wished to have met from the assembly so that we discuss and see where is this money. Because we have, I've asked your director there, the chief officer, what was the proposal from the chief officer for your budget?
In the last financial year, so it was 120 million.
Now, how do we come from 120 to 40?
It was mischief, so we are so
Can the mischief be corrected? Because again, we shall have staff in the facilities, but we are not facilitating. And that is how again public lose confidence now. That is something that needs to be done. So as senators comment, add on what I've said, Governor, these few things like those curtains, the curtains for privacy for observation, but we have also noticed even the curtains for the facilities. Something needs to be done. That's bottom line, and then you have to read that. There was no garden. There is no single garden. So even the worker, the guy, brown guy there, is peeping around the patients. And those ones within 2 weeks, 3 weeks, I think that can be solved. Facility improvement fund bill was passed. Again, those who are managing the referral, and we are happy that the chairman was also present. Where is the chairman?
I think he's gone home.
Yeah. I could notice he has given good service, good years service in this nation. So probably that's why he has left. But we are now saying, because we have the resources, at the facility. Now, like that, you know, these are the small things we cannot be coming to us now that you know, we shall deal with you and the board. Because we are not resourced to be able to do some of those small things. Sen.Jackson?
Thank you, Chair. I want to be very brief because time is much more, but I think I just want to comment about Kerenyo because I think that was an impromptu visit, and so I think Governor, that is a hospital, but now maybe could paint the picture of Nyamira. As for the referral hospital, already they knew you were coming, and so whatever is there could be synthetic. So one thing personally that I did, which the chair may not have remembered to say, I don't know whether we would call it a low morale of the people working there, because there is a lot of laxity. We arrived there at around 3, and in fact, almost everybody was leaving. Even the nurse in charge had already removed, the uniform. And so I think something needs to be done about human resource management in that hospital. I don't know whether the same obtains in the other hospitals, but I noted that there is very high levels of laxity. And then I don't want to repeat what the chair has said. Of course, we need to pave that place. It was muddy. I mean, even like a road leading into the hospital has not been done. And if possible, then we also roof those walkways. Otherwise, for now, Governor, at least have curtains in the female wards and the maternity to avoid the peeping toms from peeping at the mothers. At least for now. Thank you, Chair. I do not want to.
Thank you, Chair. Actually, I think you summarized almost everything. I commend the maternity leave. That is where I think my focus was. The delivery rooms and all that were very clean. Whether my colleague is saying is synthetic, but then at least they have maintained. What I did is that I investigated. I talked to the mothers who have been there long enough, they have been done the CSs. So I asked them how long, some of them 5 days, some of them 3 days. I asked them the maintenance of, the cleanliness, or whether today is when, the hospital was, they're trying to, so they said, no, they have maintained the cleanliness level. This woman has been there for 5 years, and she told me I've been here for 5 days, and the cleanliness level is really high. The toilets and everything, we don't have complaints, because most of the time, the complaints are in the washrooms and the toilets. So I commend, the job well done. I think I was looking at, I was trying to pick and get, the worst thing, but unfortunately, at least whatever we saw, for me, to be honest, is good enough. Even the chair asked me, if I'm taken back to the garage, can I still go back there? And I said yes. The same, I wouldn't even go to the private, I would still go back, with the level of cleanliness. But Chairman has briefed, and whatever he says, of course, I concur with him 100%. Thank you.
I think you summed it up. Just to reinforce what Senator Nyamira mentioned about the Kerenyo, the work ethic. I don't want to use the name pathetic. Can you imagine, even by the time we got there, the guys were saying we don't even know what kind of people you are, not even identifying their own senator. So, and that was the first facility I've been to where the staff are not interested. In all the public facilities we visited, the guys who are working there are normally very interested to actually, share what they are doing, what the challenges are, but here it was a very different thing, right from the nutritionist, the superintendent who had already left. So we really need to look at the work ethic in that area, and maybe that's what is pushing the residents away. Thank you.
Chair, sorry, can you allow me to commend the senator for what he has done today? I was really touched with the goodies that he has given the mothers. Seriously, I never, that was really a pleasant surprise. Thank you for thinking of them. I really appreciate it. That's even giving it to us. But thank you, Senator.
I don't know before I asked your senator here, but today is not seen as a senator from here. He has my member of my opinion. But one concern to governor that was raised by the community health promoters is that there are those who have served as community health volunteers before. I want to believe that the general understanding and agreement was that those who were serving as community health volunteers are going to transition as community health promoters. There seem to be a bit of suspicion that they are going to be left out. I want to say they have not received the kits. So I think we want to know whether there is a delay in MOH, because we thought by the time the president was launching, we were briefed that the kids have been sent to counties. So we also want to know that we also want to help you, because that's the issue of dispatch. And sometimes once a program is launched, there's always the tendency for people now to relax and delay in the dispute of those kids. And those kids are very important for the work of the community health promoters. So I think there's something there. Now I know we have unions here, and before I ask, because once Governor responds and his team, I think we want to stop there, because as a committee, our work is to make sure we put files into a report. Any issue? You want to raise with us in 1 or 2 minutes?
For visiting Nyamira County, we have to work with the team to ensure that we improve services. So for doctors, I have to say that we have a very close working relationship with the Council of Nyamira. Recently, we sat down and agreed on a few things, and we are following them. I want to report that all our consultants that we have trained, they have not gone to Kenyatta or run away from us. They are here, they are waiting for, they are giving services to our patients. The only thing I can request is that if there is a way that you can increase the resources coming out of the county, because honestly, health evolution is a blessing. We've seen a lot of improvement. Initially, we used to have patients for the dialysis going all the way to MTRH or KTRH or Kenyatta to get services. But right now, we have dialysis units here. We have orthopedic services here. The thing we need to add resources down here so that we can maintain our consultants here and even improve the infrastructure for doctors to work well. When the doctor is happy, the patient is happy. So KMBD is not only taking care of doctors, KMBD is taking care of patients too. Because we have to make sure that they get the best service. Otherwise, thank you so much.
I know our limitation of making you happy is only in the context of what we do, because if you are happy because of other reasons. That is what I like that. Anybody else from the unions, please, very briefly, community health promotion.
So many the police and what it is. Secondly, huge county have not come where for any case where community volunteers moved to get a new one. We don't have that case in Nyamira. In the case of kids, about 8% they have received, but the CUs which are far, they have not received. So they are going well.
Why have they not received? Are the kids in the county?
I am saying the CUs which are far, like the probably the head is too big. Some CUs, like, but they have received about 8%.
So the governor did the launch of the kids, I think about
Maybe we
2 weeks ago.
Thank you.
For me to move from Nyamira and work in Mombasa. Secondly, we had issues to do with that perception so-called house allowance. House allowance that is being paid in the local facilities, that is when we talk about rural facilities, is lower, and in urban areas is higher. But for me, when I look at it, it does not really make a lot of sense to me. One, this person in the rural facilities, for him to access social services, In fact, they are in towns. So it is very expensive for this person really to live in this rural area. Number two, for we people who work in this community, the so-called rural facilities, we have limited chances to access training opportunities. Like in Nyamira, we don't have a university. If we were in a town, we can equally do career progression during our off, during weekends, during evening classes. But at our place here, in fact, we don't have. So I wish that during those periods that you think about giving or awarding scholarships. In fact, these scholarships, many of them are awarded to people who work in towns. Can it really trickle down into us people in the village, such as we get that kind of opportunity?
I think two of your questions will not be solved by computer. On the portability of human resource for health, I think one of the things we must appreciate this time around is the Human Resource Advisory Council is one of the organs now that has been operationalized, and part of the things they are having a conversation in that Human Advisory Council is the issue of transfer. You understand that Nyamira can release you, but Mombasa says we can't take it because it's a payroll issue. Okay. However, that is a matter that has been seized by the Human Resource Advisory Council. And I think if we in county governments and in devolution give a chance to this Human Resource Advisory Council and national government, because for the first time, we have a body where we are equals. Those of us who are in devolution space and those who are in national government, to canvass this matter so that I think that's one. But this one of training will be chief officer and government and I hope, ladies and gentlemen, you know, there is normally a disease called headquarter syndrome. It happens in national government, it happens in counties, it happens everywhere. Where there's an headquarter, there is always a tendency for those in the headquarter to go for all trainings. In fact, there are people who need to leave in training. So I think Governor might respond and the people that tell us how they are ensuring equity in terms of making sure that those who are in the public facilities are going for training. Any other person from the news, please? If we put you on contract as a nurse for 30,000 or 40, for 3 years, the 4th year, you automatically become a PNP. We want to create room for planning, mobilization of resources, but meantime, you have something. How many of the nurses now are just at home? And these skills will also fade. That is why you find watu wanaandikwa, wanatafuta mshipa, wanadunga wewe mpaka mkono inaonekana ulikuwa unafanyiwa tattoo. Akitafuta mshipa kwa gari. It's not their fault. They are not being practiced. Why don't we give them the opportunity to practice? So we want to have an honest conversation. Because part of the stagnation in terms of career, you cannot go to school because you are not released. We don't have enough. Yeah? Doctors are making noise, they are not being released, they want to go, but secretary, 10 of you want to leave Nyamira at the same time, sure, and you are 16. How possible? So I think let's have a conversation so that we have a schedule, and you know we can have a plan, and everybody knows. I'm not going this year, but in the 3rd year, I'm the one scheduled to go for training. You know, let's accommodate one another so that we make progress. I'm not trying to respond on behalf of the governor on some of the issues, but I'm only pointing out areas where we need to have a national conversation so that we are able to start our facilities, we are able to relieve their members. Some of your people are not even having an off. You know, you also have families. How can you be working on 7 days, then you are told emergency and you are nowhere? Why don't we increase this stuff so that when you are on your off days, at least you can be comfortably away from your station even for 4 days? So, Bwana Kimosi, hii mazungumzo lazima tutaendelesha. Kwa vile lazima tukubaliane pia na SRC, they have been a bit, you know, so they look like they don't have a position, we want to engage. But we want to work now, all of us. And as per their code that we signed in commission, we want to facilitate. We want to know what is it. We don't want also now people like SRC to come in between here also with a lot of things that happen. who want to facilitate. So we are going to be inviting you for that conversation. But Governor, there are a number of issues here. I'm sure we can leave one copy with you. The good thing you said, the others that are being addressed. So it means there's progress.
Governor, my colleague senators, you have more or less given a summary. I just want to try to know where to begin on here. All that is only maybe next time we come back to get a hold to go around the facilities. Governor, during the question about somebody was born in a public hospital. Please take care. Even if it's as raising one day, we put curtains for the walls so that they privacy. You know, even for you, that as a human being, you sleep at night on a window like this with no curtains. It will be humanized. But you know, those are poor people. They have nowhere else to go. So I would request that you ask and address the issue of some other violence so that patients have privacy and a human face to the facility. That's a level 4. We want to see where we are. If you go to Rodisa, this is another level 4. They are far higher. It's good to also tour these facilities so that we gauge ourselves to know where we are. Even what was that said? There's a one at Somerset. There's a nursing station. The Somerset is completely worn out. So those are things we can fix on a very short notice on urgent places. And then the issue of, I think, the drugs government. It's good that we get reports on the requisition, supplied and received. We saw a few issues on the stores and mines. I think we were there. So we even made a proposal that if possible, you can request to grant our drugs. You know the way we used to go to hospital those days, that you receive government of Kenya, malaria kit. You can get branded drugs. Because we are human beings. We always get people who are not very honest, who want to swim away drugs. So that can be done. It will be nice. Then finally, specialists. When I compare what we have at the visa, we only have one gynecologist. Only one. We only have one. We need one. In fact, in Lomisa, there are more specialists than what the operating people can handle. They have done a big investment on specialists. And then we also hope this Dr. Plaza, and you're fighting for the people of the name. We don't want to reach a facility that only has the resident of people, a bridge, and a microscope. I hope we can do something, and we can compare that. The budget for drugs in Globisa is 200 million. In Nyamira, we are doing 40 million. It's a big mistake. Otherwise, I don't have much.